Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Well, hey there, and welcome to this week's episode of the podcast. Today, we are tackling a very common question that I get from my clients, and that is, what is a brow lift? How does a brow lift work? Essentially, what is this all about? And today we're going to tackle this particular topic because it is a very, very common procedure and something that a lot of my clients love to have done when they come in and they're getting neuromodulator treatments. So we are going to be raising brows and spirits as we explore this fascinating world of brow lifts with neuromodulators today. Now, before we delve into what a brow lift is, I think it's important that we first talk a little bit about the anatomy and what we are actually speaking about. Well, when we're talking about a brow lift, we're talking about the eyebrows and how we can lift those up. Underneath those eyebrows, of course, we have various anatomical structures. Most importantly, when it comes to brow lifts, is having an understanding of the muscles in this area. And the biggest muscle here, the most important muscle here, is the orbicularis oculi muscle. So what is that? Well, I've actually recorded a complete podcast episode specifically on the orbicularis oculi muscle. And if you go back in the archives here, not too long ago, a few months ago, you'll find that episode. But today we're going to focus specifically on the anatomy as it relates to brow lifts. So with that said, the orbicularis oculi muscle is a circular muscle that circles each of your eyes. So essentially you have two orbicularis oculi muscles, and they are round muscles that encircle the eyes. They essentially act as sphincters so that when you contract down on that muscle, it helps to close the eye and make the eye, for one, appear smaller, and two, it does actually help to a certain degree to close the eyelid, although there are also other muscles involved with that. So what does that mean? It means that if there is a way that we could relax the orbicularis oculi muscle, it would allow the eye to look more open. And critically for this particular topic at hand, when we allow that orbicularis oculi muscle to relax, that circular muscle essentially gets bigger and the overlying skin appears wider, further away from the eye itself. And when you have an eyebrow that is sitting on top of the orbicularis oculi muscle, that in turn appears wider or further away from the eye. So what ends up happening is that the orbicularis oculi muscle relaxes, it gets bigger, appears wider, the overlying eyebrow gets further away from the eye, and that is how you get a brow lift. Now, there are various nuances and various things that need to be taken into account when we do this type of treatment, because this has to be done at the precise location where you want to get the brow lift. If you put this neuromodulator in an area that is not precise, you can end up with various side effects. You can end up with a brow droop. You can end up with an eyelid droop, and you can end up with other various complications. Now, fortunately, if you put the neuromodulator in a particular area that you're targeting, then this is very reliable and it is a great simple treatment. So just as a quick review, I've discussed this previously on other podcast episodes. How does a neuromodulator work? Again, there are a number of different brands. We've got Botox, Nuceiva, Dysport, Xeomin. They all work the same essentially, but when you inject that into that particular area, it relaxes the muscle. It interrupts the signal between the nerve and the muscle. That's how it relaxes. And then when it relaxes, it doesn't contract as much. In the case of the orbicularis oculi muscle, as I mentioned, when it contracts, it is like a sphincter squeezing in from all sides, making that circle of muscle smaller. And when it relaxes, it gets bigger and the eye appears more open. So how does this work practically when you come into the clinic? Well, we look at your eyes and we look at the location of your eyebrows and we discuss that because there are different subtleties when it comes to eyebrow placement. Some people like to have a brow that slightly lifts more laterally, meaning as you get further away from the center of the face, more towards the ears, they like the brow to be raised a little bit. And that's probably the most common way to do a brow lift. Other people like to have a more horizontal eyebrow. Some people like to have a little bit more of a peaked eyebrow. And each one of these very customized approaches is critically important to me because that's what I believe in. I believe that each treatment should be extremely customized and yet natural as well. So the first step, of course, is to have this discussion with you. We talk about where your brows currently are located, how you would like them to ideally be located, and talk about if that is a realistic expectation based on using the neuromodulator. If that is the case, then we will decide on the appropriate dosing for the neuromodulator. And then it is a very, very simple treatment. For the brow lift part, it essentially involves one injection into a precise location near the area of the eyebrow where we want to have it lift. This can be done, of course, in conjunction with other treatments with neuromodulator. And then within a few days, you will notice that that brow will have a subtle lift. Now, of course, depending on the dosing, this may or may not be more apparent. And this is something, again, that I'd like to discuss with you to make sure that the treatment is exactly what you want and customized to your liking. Once that's done, that's essentially it. The neuromodulator can last for about 3 months at a time. And then we can repeat the whole process and we take it from there. So that is a little bit about brow lifts today. I hope that is helpful to you. And if you want to learn more about brow lifts or have a treatment done, please come in and see me. I just want to mention as an aside, thank you to all of you that are listening to this podcast and enjoying the content. And as a result, coming in and seeing me, I had the pleasure of meeting a patient this week who said that she was introduced to me just strictly through this podcast. And she wanted to come and chat with me. And it was a real delight to be able to meet that person. So if that is somebody like you and you hear the podcast and you come in for a treatment, by all means, let me know that you heard this through the podcast. And it's always a real treat for me to meet those clients as well. With that said, if you do want to leave a review for the podcast, that means the world to me as well. And you can do that through any of your favorite podcast players. Thank you again for tuning in this week. I look forward to chatting with you again very soon. Till then, be well, and I'll talk to you soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.